bill isn't expected to make it past the Senate, and even then, the president has threatened a veto. But House Republicans like Sullivan say they'll tackle specific provisions of the law next. Nearly a year after President Obama signed the new health care law into effect, Americans remain divided.
It's difficult to start over again. I think the Congress had the right idea to try to repeal, even though they may not get by with it.
I think right now, still in repealing the health care law, they should add on to it.
Republicans have a backup plan if the repeal stalls.
What we're going to do is look at multiple approaches. We're going to look at repealing just the individual mandate part, the part that requires you to purchase government health insurance.
Representative John Sullivan says there are parts of the law he supports, like coverage for those with pre-existing conditions. But he says the law as it stands now needs to change.
We need to reduce the cost of health care. We need reforms in health care, but this is the wrong approach, and we can do it in a different way.
Beginning in 2014, the law will require millions of Americans to carry health insurance. Local physicians say they've already started seeing some effects of the reform in the form of federal dollars.
It's made a huge difference for us here in Tulsa, and Tulsa citizens can be extraordinarily proud of how the community has mustered its resources to make sure that we get the advantage of the health care reform.
Dr. Dan Duffy is dean of the OU Tulsa School of Medicine. He says Oklahoma needs help getting more people insured, but he thinks the law needs revisions.
That's where we need to be going, is creating a really good dialogue and debate about what's useful, what isn't useful, and get it right.
Now, we've just learned Oklahoma Attorney General Scott Pruitt has filed a legal challenge to the federal health care law. More than half of the nation's states have filed suits against it. Sarah Goldenberg, 2 News, works for you.